Hello everyone. I will talk to you about the concept of One Health and how the connective wisdom of Ayurveda helps us to achieve One Health. So, One Health is an approach that recognizes the interconnectedness and interdependency of health of humans, animals, and the environment. It is endorsed by the leading organizations like WHO, the Center for Disease Control and Prevention, and the United Nations Environmental Program. So, One Health concept highlights the that human health ultimately depends on the health of animals and the environmental resources we used to share, just like air, water, soil, and ecosystem. It seeks to promote interdisciplinary collaborations across human medicine, veterinary medicine, public health, environmental science, and other fields to achieve optimal health outcomes for the people, animals, plants, and our environment. Though a holistic lens of One Health, actually it addresses the health risks emerging from the interconnectedness of people, animal, plants, and our shared environment. So this includes risks related to zoonotic disease, antibiotic resistance, food safety, pollution, contamination, and other ecological and public health threats. So achieving One Health required specific policy, education, means the awareness about this concept, and actions that promotes the well-being of all species together with the integrity of environmental system. Here, Ayurveda views the human body as a microcosm or miniature version of the macrocosm that is our natural environment. So what happens in the broader ecosystem means the macrocosmos that is reflected within our own physiology. So the modern ecosystem uh, science, it reinforces this interconnectedness, and also researches shows that our health is shaped by biodiversity loss, pollution, climate change, and the disruption of natural balance. So, like a ripple effect, uh, environmental degradation that creates imbalance in our bodies. So, we see rising rates of diseases linked with to environmental factors, just like the autoimmune disorder, infertility, different type of cancers, organ damage, and of course many more. So at the same time, our body uh, contains trillions of microbes that evolves with the plant and the animal kingdom. So this biological kinship runs deep, and that's why the One Health approach seeks to heal these broken bonds between humans and the environment, safeguarding the macrocosm supports well-being within our microcosmic bodies. The reverse of this is also very true, that and the thought is supported by the Ayurveda principle. Balancing the system within us cultivates the wisdom to restore balance outside. So personal and planetary health, these go hand in hand. Ayurveda timeless teaching reminds us that human health cannot be separated from the health of living birds. So, what affects one actually affects all. So, only together we can um, craft an ecosystem and future that allows all lives to flourish. So now let us see that how the value of biodiversity, nutrition, and sustainability aligns with the Ayurveda principles. So as we know that Ayurveda emphasizes balancing the body through natural and wholesome food and use of uh, medicinal herbs. So this aligns the sustaining biodiversity for health also. India's ancient forest provided a cornucopia of healing plants used in Ayurveda medicine. So protecting wild ecosystem that used to preserve these botanical treasures. This biodiversity also cultivates soil health through nutrient cycling, supporting nutritious crops. Diverse gut microbes aid digestion and immunity to in our body. So Ayurveda recommends seasonal eating attuned to nature's rhythm. So this honors sustainability, reducing energy consumption from unnatural food production and transport. So localized, low impact agriculture that prevents topsoil loss and water pollution while nurturing more vitamin rich produce. In a sense, Ayurveda sees health as growing from a balanced ecosystem, and our food choices can nourish biodiversity or even degrade it. So, sourcing organic local food connects us to the web of life. Um, Conserving nature's wisdom sustains the time tested health solution uh, she provides. So, from seed to table, from farm to forest, choosing sustainability fosters the diversity of life that nourishes us, our body, and soul. Even medical researches increasingly reveals just how much our lifestyle and environment shapes disease risk. So, a study shows that obesity, smoking, inactivity, and poor diet, these are strongly linked to certain diseases, just like the cancer, diabetes, and heart diseases. Even mental health also depends on lifestyle factors like sleep, community, and time how you spend in outdoor activities. So these environmental pollutants, they also play a major role. So here, air pollution, these particles are implicated in lungs and causing the diseases like the asthma, cancer, and several even developmental disorders. These heavy metals and chemical exposure, this disrupts hormones and our biological functions also. Different type of climatic change supports the spread of various infectious diseases through warm temperatures, weather extremes, and ecological disruption. Increased ultraviolet exposure may raise skin cancer rate. Here we can see several evidences. Um, those evidence underscores how human health is profoundly affected by both personal habits and the world we have engineered around us. So this reflect how um, Ayurveda teaches the well-being arises in the harmony with nature. But we have created an imbalance that breeds diseases. So, restoring health demands a lifestyle and environmental reform from minimizing toxins to building green infrastructure and paths that promotes activity and mental wellness. The choices we make either individually or collectively. So they have the power to write a new story of health and harmony with our environment. So there is a need for holistic healthcare policies addressing wider determinants of health. The state of our health is not defined solely by medicine and healthcare. It is largely shaped by the social, economic, and environmental conditions in which we live, work, and also play. So, to most health policies, they focus narrowly on access to medical treatment. Actually, they fail to address these wider determinants that are making people sick in the first place. So here we need a Ayurveda guided holistic approach that looks upstream to prevent disease before it starts. In essence, health emerges from how we care for people and the planet. Healthcare is only one part of a holistic equation, which actually we are having. Um, Truly, healing requires health policies addressing root cause, not just symptoms. This means structuring our societies and economies to sustain the well-being of all people and our shared environment. So the future of human health used to depends on implementing the this holistic vision across all the sectors of society. The time for fragmented approaches that has passed, and we must weave wholeness into the fabric of our lives together. So now let us see that how Ayurveda exemplifies a connected ecological model supporting one health goal. So as we know that Ayurveda wisdom offers profound relevance for interconnected health today. This living knowledge was forged over millennia through direct observation of nature's pattern and deep inquiry into the human conditions. Ayurveda's model of health resonates deeply with our current understanding of ecology and health sciences. It provides a holistic framework to support well-being in body, mind, and spirit while living in balance with the earth. In our era of this chronic diseases and climate crisis, Ayurveda all the time reminds us of timeless principle of health and sustainability that align with nature's inherent wisdom. By integrating these teachings with the modern science, we gain insights and tools to craft a more conscious, symbiotic relationship with the planets that nourishes us. So, weaving the wisdom of ancient healing system like Ayurveda together with the modern science, modern medical system that used to chart a hopeful pathway for humanity to sustainably thrive in the future. While modern medicine has made enormous advances, as we know all that, but its approach is often fragmented and more focused on a single aspect. So here, all the ancient sciences offer profound, profoundly connectedness or a model of connectedness of well-being spanning throughout the body, mind, society, and ecology. So here the integrative solutions draw from these holistic paradigms along with the leading cutting edge research. For example, Ayurvedic practices are being combined with the nutrition science, psychotherapy, exercise physiology, and many more. So, blending the best ancient wisdom and contemporary knowledge provides a template for a planetary health era. If we are to meet the complex challenges of our times, while actualizing human potential, we need integrative system that sustainably support the flourishing of all the life. The way forward entails weaving a tapestry of knowledge system with the common thread of promoting the health of people and our planet together. So now there are certain questions for you, and even you can take it as a challenge for you for your project. So the first question or the challenge is, how can Ayurvedic principles be integrated into medical education to cultivate holistic health perspective? Second is, how can sustainable practices preserve biodiversity of Ayurvedic medicinal plants? Third one, how can Ayurvedic architecture and nature connected lifestyles be incorporated into urban planning for preventive health? The next challenge is, how can technology customize Ayurvedic recommendations based on dosha constitution, that is Prakriti? Can a study investigate effect of Ayurvedic diet on microbiomes? Do Ayurvedic interconnectedness principles align with the system biology and ecological health models? So, thank you very much and good luck for your projects.
Very good morning to everyone present here today for this session. And I'm Dr. Saurabh Agrawal, and I wish you everyone a very, very happy Vishwa Ayurveda Divas. May Lord Dhanvantri bless you with all the good health and happiness in your life. Also, advance wishes for the upcoming Diwali. May this Diwali brings a lot of prosperity in each and every one of our life. So let's begin our session today. That is food, which is based on season and geography. A very famous French chef and philosopher rightly said that to eat is a necessity, but to eat intelligently is an art. And we all know how expensive is art and how difficult is it to make art. A good painting sells around in millions, and so is good health. Whatever you pay, good health cannot be purchased. So, similarly, we have to eat healthy and we have to be very artistic while eating by knowing all the principles and logics behind the eating of food. So, what is the aim of Ayurveda? Commonly, when we go to an Ayurvedic physician, is when we are not well or when we are sick. But Ayurveda initially was developed or was brought on the earth by the aim to maintain the health of an healthy individual by performing dincharya, ratricharya. These are the basics of lifestyle modifications which we talk about today. And if a person is by chance not following any of these regimes, then only he'll get ill. So by performing all the regimes which are mentioned in Ayurveda, a person was supposed to be healthy forever. It is told that Lord Brahma himself gave the knowledge of Ayurveda on this earth for the upliftment of all the human beings present here. We all know how important is food, but in Ayurveda, it is one among the sub pillars which help to maintain our health. We all know why food is necessary, but in Ayurveda, it is told that it is the balancer and carrier of vital force, that is prana. So, whatever we do in our life, whatever we speak, whatever we sleep, how we eat, whatever we do in our daily routine is all because of prana. And a person is said to be dead when the prana left the body. So, to maintain that special thing known as prana, the life in our body, food is important. It is told that by consuming proper food, it increases memory, digestion, energy, strength of mind, and ojas. So, ojas is one of those things that cannot be described by a single feature. Ojas can be correlated to good immunity, to good vitality, to complexion, and many other things. It is clearly told in Ayurveda that if you are healthy, your food is responsible for you, and even if you are sick, the food is responsible for you. That's how much important is food in our daily life. So before jumping into the seasonal part and the geographical part, let's consider some of the general guidelines which must be kept in mind whatever eat whatever you eat, whenever you eat, and wherever you eat. So the first question comes is how to eat. Nowadays, everyone is knowing about what all to eat, how much to eat, but we don't know how to eat. People are forgetting every day how to eat. But in our ancient tradition and even in our daily society, we can see like those people, especially the older group, like I have seen in older groups, especially those who are 80 years and above, they still adhere to these principles, I would say, and they are still very much healthy as compared to the younger generation, our generation, which I would say. So the first point in how to eat is we must always eat warm and fresh. In the ancient time, there was no refrigerator, so of course there was no concept of cooking one meal at a time and just preserving it for the next of the days. So, or the frozen food concept was not there. So they have always told that we must always cook fresh and we must always eat warm food, always use ghee or oil with the food. We must always consume in proper amount. Here amount not only means like how much can we eat in the number of rotis or in the amount of katora, kitna katora khaya. We don't measure the amount in that, but we have to see in the macronutrient and macronutrient part of that. We must always eat after the proper digestion of the previously consumed milk. We must not eat too fast, nor too slow, and we must always refrain from talking and laughing. We must eat with full concentration. Nowadays, we are always distracted with television, mobile phone, newspaper, blogs, laptop, tablets. We are always distracted. But until and unless our full mind is into eating, that then we cannot appreciate the quality of the food. Even our brain is not able to understand that how much of juices or enzymes it has to secrete, or it is not able to make out when our stomach is full and we must stop eating. Because of that, only majority of disorders are happening because we lack concentration while eating. And the next important point is we must always include all the 6 days which are told in Ayurveda. So in the previous slide, we discussed like what are the we must eat always after the digestion of the proper digestion of the meal properly. So these are the features which clearly denotes our body, which clearly denotes that the previous meal that we consumed is digested. So these are like after eating, after the proper digestion, the person will get a clear belch. Dakar ekdam saaf aayegi, which will not have the foul smell or the smell or the odor of the previously consumed meal. The person will be always excited after after the proper digestion. Excitement here means he will not be lethargy or he will not be lazy to perform his normal chores or jobs. He'll have a proper urination or the defecation urge. He'll feel light, and of course, because the glucose level in the body is decreasing, the previously meal is digested. the stomach is empty, so the stomach will send a negative feedback to the brain to eat, and so that will have the person will have the urge of hunger and thirst. The next concept regarding the general rules, I would say these are not general; these are very specific rules that every must follow. So these are eight different domains of guidelines. So among those eight different domain of guidelines, we'll be discussing only two because discussing all the eight will be too lengthy, and it's a topic of discussion for some other time. So today we'll be only discussing regarding Desha and Kala. Desha means the geographical location, and Kala here will be meaning regarding the ritus or the seasons. In general, if you talk about beneficial diet, then this is the chart. You can take a screenshot. Discussing or naming each is not important here. But yes, if you don't know anything regarding seasonal diet or diet according to the proper geographical location, you can keep this as a screenshot in your kitchen. You can take a printout of this, and you can always include these dishes in your daily diet. It will be very helpful for your good health, and these are the things that has to be avoided for regular consumption of the same. We can see there are many different things, like in the cereals we must not consume barley and poha, the flattened rice poha. We must not consume it every day. In meats we should avoid these, and sunflower oil must be avoided. The rainy water, the river water must be avoided, although nobody drinks or very few people drink rainy water or the river water during the rainy season. But yeah, we have to avoid such things in our daily life. Talking about seasons, so in our Hindu culture and also in the Indian tradition, we have six ritus or six seasons, which we call it. Those are Shishir, Vasant, Grishma, Varsha, Sharat, and Hemant. Among that, Shishir and Hemant, the first and the sixth one, are the cold seasons. The As we process down, we reach to Grishma, that is summer. Vasant will be springs. Varsha is of course rains, and Sharat is autumn season. Depending on the season, why do we need a different diet on every season? In every season is as the season progresses, as the sun goes from north to south, then back to north, the strength of our body uh, comes and goes down, means it increases and decreases both the strength and the digestion power. So to maintain that healthy status of yours, we cannot take the same diet throughout the year. If we consume heavy food when our digestive power is low, then that will definitely lead to indigestion, and we'll have to take medicines for that again. But that could have been easily avoided by consuming light food instead of heavy food. So that is why there is a strong need of consuming diet according to the ritus. The next feature is the doshas in different ritus. So, as we in Ayurveda, the three pillars in the starting we discussed the three sub pillars. Sub pillars includes ahar, and the three main pillars is vata, pitta, and kapha dosha. So, in the daytime, in the age-wise time, and throughout the year, these doshas come, increase, decrease, and comes on the verge to go to their different places. So, to avoid any consequences of ill health because of their movement, because of their aggravation or accumulation, we must eat the food which is opposite of their quality. So, it is a big science itself, and we are still studying. We are like 5.5 years of BAMS, 3 years of MD, and again 3 years of PhD, 3+ years of PhD. Now we are able to understand, and I can't explain it to you in just 10 minutes regarding the doshas, but we have to keep in mind why do we need that custom diet because of doshas. As the dosha increase, we have to take the opposite quality of diet to pacify that dosha. So let's jump into the diet based on different season. So you can see in this, like the principle behind choosing diet in winters is the taste predominant should be sweet, sour, and salty, and the quality of the food must be untouched and warm. So commonly, just think about it in our traditional diet, especially I'm from Jodhpur, and I can tell you, like during the winter season, what how do we eat? Like we eat heavy food, we eat lots of sweets. Carrot comes in that season, so we eat gajar ka halwa, we eat atte ka halwa, many kind of such things. So the intention here is in the winter season, our diet, our digestive fire is very strong. So to supplement good amount of energy, we can eat heavy food in a good amount so that our body gets nourished well. So these are the few things that can be eaten during the winter season. I'm more of a sweet tooth guy, so let's only see the last of the slide. Like you can have kheer, halwa, laddu, gajak, such things. And in the first point, you can see that bajra and maize is also there. That is also common food during winters in the Jodhpur area. In the spring season, the concept behind choosing that the taste of the food must be predominant of pungent, bitter, and astringent taste, and the quality of the food products must be light or spicy and warm in the quality. Based on such qualities, these are the few examples that can be taken, that can be consumed during the spring season. Spring here is Sharad Ritu. Sorry, my fault. Spring here is Vasant Ritu, that is the second Ritu, and it falls between mid of March to mid of July. So mid of May. Next, when we go to summer season, so commonly also we know in summers, what do we drink more? We drink a lot of lassi, we drink a lot of sweet chach, or we drink a lot of glucose water. And what is the temperature of it? We prefer cold water or cold drinks. So here, cold does not mean you have to refrigerate or you have to drink it icy cold. It must be cooler than the normal room temperature. So the matki temperature, the temperature which we find in matki, is always the preferred temperature, which is approximately 4 to 5 degrees lower, at least 4 to 5 degrees lower than the normal room temperature. So in summers, uh, we must consume light food and we can increase the frequency of eating so that our body always gets the amount of energy and glucose it needs. So commonly it must be juices, buttermilk we can drink, raita, sharbat, or Ayurvedic panak. Panak are different decoctions which are made using Ayurvedic herbs and spices with guda, which is served cold. So these are the few things which can be taken during summer season. During the rainy season, the predominant taste. See, in all the ritus in any of the dish, all the six tastes must be eaten in every meal. Here we are telling to increase the quality of these and increase the quantity of these tastes as compared to other tastes. So here in rainy season, sour, salty, pungent, and astringent taste must be consumed more, and the food must be dry in quality. It must be warm, and the food must always ignite fire. Like it should not be like after eating that you are feeling your stomach is full or you don't have the appetite, but it should always ignite the digestive power. It must be easily digestible and it must be good for your digestive power. So in rainy seasons, especially in Jodhpur, when we go out near the sweet shops, there's always a huge line, people demanding for pakoras or mirchi bada, especially in Jodhpur. So even in Ayurveda, it is told that the dishes which are fried in ghee or which are fried in oil must be consumed during the rainy season because, as I told before, because of the doshic movement, because the doshas go up and down, and that particular dosha in Varsha Ritu or the rainy season, to pacify that dosha, we prescribe such foods like pakoda. Mind you, whatever we are discussing here is for healthy individuals, apparently healthy individuals. Could be changed based on the health status or the disease condition of the patients. The thumb rule here, whatever we are discussing in different ritus, if you don't know anything, the only thumb rule is eat what it is growing at that time. Whichever fruit or vegetable grows in that particular season, we must consume that. That is the simplest thing which we can do. But yes, regarding cereals, we can't do that. That's why, because wheat and rice are harvested only a few months in the year. So regarding wheat, rice, we have already discussed what all can be consumed regularly. And regarding fruits and vegetables, we must consume only those which grow locally in that particular area, or which grows in that particular season. In the autumn season, sweet, bitter, and astringent quality taste foods are needed, and which are light and cold. Here, pulses you can see moong and masoor, and these are the few vegetables which are here mentioned. Now let's talk about Desha. In Ayurveda, biosphere, the geography is divided into three main geographical lands, which we can call it. Those are Jangal, Anup, and Sadharan. So here, in the first photo, we can see the Jangal Desh, which is dry and arid region where water is scanty and rainfall is scanty, and the temperature is higher as compared to other areas. In the Anup Desh, this is the Anup example of an Anup Desh. Here, the area is marshy with lots of humidity in the air and high rainfall. The third one, this is Sadharan Desh, which is the mixture of both, where arid lands is also there, balanced rain is there, and lots of forests are there. So if we compare it into the Indian geography, so Rajasthan, the western Rajasthan, the desert area where there is low rainfall, like Jodhpur, can also be considered among the Jangal Pradesh, that is the arid zone. Among the Anup Desh, that is the marshy land, we can consider it to the coastal areas of India, like Goa, towards Kerala, towards Western Ghats, towards Tamil Nadu, towards Northeast, the Seven Sister States. That can be considered as Anup Desha, and Sadharan Desha, the balanced Desha, is like Uttar Pradesh, Chhattisgarh, Bihar, Madhya Pradesh, West Bengal, because there are huge dense forests, and the rainfall is also balanced. We rarely listen regarding floods in these area, and also the droughts in these area. So based on that, here is basic diet chart here. So again, why specific diet is needed in that particular dosha? It all depends on the doshas. So a particular dosha like Vat and Pitta is in predominance in the arid zone. Vat and Kapha is predominant in marshy zone, that is the Anupdesh, and in the what do we call this Sadharan Desh, there is no variation or there is no particular ups and downs of dosha. The doshas are physiologically balanced. So they people residing in Sadharan Desh can enjoy the food which is consumed both in arid and marshy lands. In arid lands, we must consume uh, higher quantity of ghee and tel. So that's how we eat in Rajasthan. In Rajasthan, without ghee, no food is served. Even to the beggars, we give roti with ghee. Right? In our homes, we pour at least 2 or 3 times of ghee whenever we eat. So that is why that is our physiological balance. That's how we balance doshas naturally also. So when you go to Kerala, if you have been to Kerala, you will be knowing that the consumption of ghee is very low there. Nobody commonly eats ghee, or nobody commonly eats a lot of butter there. So this is the general guideline regarding uh, food habits in different geographical areas. So here is a sample diet plan which you can maintain in the autumn season. So now, as it is first November, so this is Sharad Ritu, and Shishir Vasant Grishma, Varsha, Sharad, and Hemant. After Sharad Ritu, Hemant Ritu will come, which is the beginning of winters. So in this Ritu, the autumn season, which we can call it, we can take this kind of diet like milk with honey and wheat paratha made in ghee. Then for lunch we can have a lady finger sabzi, because in market you can get that easily. Turai ki sabzi, then karele ki sabzi you can get. Rice with moong dal or masoor dal, buttermilk with rock salt. For dinner you can have moong dal and rice khichdi. That is light in digestion, so we can easily eat it in the dinner. For desserts we can have kheer or moong dal halwa. Fruits like pomegranate, grapes, dates, which are abundantly available these days, we can eat that. And for the next season also, I have mentioned here for the Hemant Ritu, the Ritu when we eat well, we must eat well, we must eat lot of ghee in that Ritu. So these are the few things that can be eaten. So as we all know, like in Jodhpur during winters, we eat bajre ki khichdi. with lot of ghee, makki ka dalia with lot of ghee. So these all things pacify vata. So pacification of vata in cold season is very important, otherwise it will lead to many disorders based on that particular dosha. So, by concluding, these things we must always keep in mind to remain healthy. First point is regular and timely eating. We must never skip meals and we must eat regularly and timely. We must consume adequate amount. We must not mix the quality of foods which are opposite to each other. We must always be local, we must always prefer locally grown foods rather than exotic foods. These days, it is a trend to eat exotic foods, but in Ayurveda, it definitely condemns it. It says that whatever is grown locally, we must eat that because nature, Mother Nature, is giving us whatever is required for that particular area. And we must always follow seasonal regimes. These are the references from which this presentation was made. Thank you. Yeah. So my first question regarding the presentation which I did right now is like how and on what parameters, apart from general well-being, can we measure the changes that occur inside our body when we consume or in case we don't consume the foods based on season and geography? I hope I made clear. Like in short, how will we see like what are the changes that happens inside our body apart from general well-being when we consume or don't consume foods based on season and geography? That is my first question. And my second question is like by following those criteria, that by following those guidelines which are told according to the season and desha and other things also, like can we avoid or can we cure hereditary or genetic disorders among the individuals? So that is my second question.
Hello and welcome to this short talk on Ayurveda for One Health, a food systems perspective. I would like to take this opportunity to discuss why what we eat matters in the context of One Health and how the concepts of Ayurveda can contribute to make this diet more sustainable and pragmatic in the context of One Health. Hi, my name is Megha. I'm an associate professor at the University of Transdisciplinary Health Sciences and Technology, and I'm very pleased to be making this presentation to you. Let's start with a food that all of us may have enjoyed in the past few weeks. It was the Shara a week back, and it's going to be Diwali soon. There is plenty of desserts to go around: kheer, mawa kachori, ghevar in Rajasthan, rabdi, kalakand, peda, chhena malpua. I will stop and ask you, what is the one ingredient that is common to all these sweets? If you guessed milk, congratulations, you know your sweets very well. So let's look at how, with this one particular ingredient, which is milk, we can apply the concepts in Ayurveda for One Health. To do that, let's start with where Kshira or milk is coming from. And in my presentation, I will focus exclusively on cow's milk or go Shira. The milk that we consume starts from a cow and it is processed by a dairy farmer and packaged through a cooperative in a plastic bag, or maybe if you're really lucky, you get your milk directly from the farmer. From here, it comes to us, the consumer, and we consume this milk in many different ways, either by itself or you ferment it and have it as curd. You Stir it and remove the fat and add some jeera and drink it as chas or buttermilk. You remove the fat portion of this milk and you get butter, and once you remove the protein component, all you are left with the triglycerides in the form of ghee. Or if you boil the milk down completely, you are left with a fat and sugar and protein mixture, delicious khoya, to which if you add sugar, you can make many different types of Indian sweets. Now, in this food systems perspective, how is it that we can think of One Health and Ayurveda concepts? Let's try to begin at the start, which is the go or the cow, which gives us this milk. In the current time, dairy farmers face an uphill task. Taking care of a cow is not easy. There is a lot of water, fresh water, that is required, and also a feed that is reasonably priced. Both in terms of food and water and care, there is plenty of advice in Pashu Ayurveda. Importantly, many cows are fed hormones for increasing the lactation. They are fed with antibiotics in case they have infections and diseases. And not to mention the pollution that is caused from a dairy into the water supply. Now, all of these are areas in which we can certainly apply Ayurvedic principles from Pashu Ayurveda. We can have feeds that are better aligned to cow biology. We can have medications and herbal based products which can be grown by the farmer themselves and applied to the cow in the case of diseases. We can also use some of the advice provided in Ayurveda to make very good biofertilizers and, in some instances, medicinal compounds. Let's consider the next step in this phase, and that is what milk you and I consume. In terms of One Health, perhaps we should become more aware of the different types of animal milk products that are available and how they might be differentially suited to the climate that we live in. In dry climates such as in the desert in Rajasthan, it is easier probably to get camel milk, which is slightly salty and sweet, as compared to cow milk. Goat's milk is also sweet, but Ayurveda considers it to be lighter to digest as compared to cow milk, which is heavy to digest. Not only do these properties change with animal, they also have a different impact on us as human beings. Not all of us enjoy milk or can enjoy milk. Not all of us will benefit equally from its nutrition. Ayurveda provides a systematic framework to understand what this impact would be on each one of us depending upon our prakriti. Moving on into this supply chain of milk, when you convert milk through fermentation into curd, Ayurveda suggests that there are 8 different forms based on the amount of processing or fermentation that it has undergone. And depending on you as the person, and perhaps in certain clinical conditions, you would have to consume different types of dadhi or curd. Instead of curd, another option is to consume fermented buttermilk, which would also be a great source of probiotics, as buttermilk or takra. And this buttermilk is light to digest. More importantly, it can be modified based on not only what climatic conditions you live in, but also the type of person you are. In dry climates, it can provide lots of water. And if you are perhaps a vata predominant individual, you would benefit from having some jeera Or for a pitta individual, you might benefit from having a little bit of sugar and coriander leaves. And for kapha individuals, maybe chilies and garlic. All these modifications are simple and will allow us to consume and get benefits from these food milk products. And now moving on to butter and ghee and khoya. I will spend some time only discussing ghee in the context of One Health. Ghee is one of few substances which Ayurveda says is a nitya sevaniya ahar. It is also very specific. It says it is gogritha or ghee from cow's milk that is suggested to be something that can be consumed every day. The properties of ghee from a biochemical perspective is that it's rich in triglycerides. In fact, more than 99% of it is triglycerides. But along with this fat, it is also enriched in fat-soluble vitamins like A, D, E, and K. From an Ayurveda perspective, ghee is both lubricating and cool, and so it is very suitable in a hot and dry climate. Ghee is also an anupan and a great way to take certain medications. India is the largest producer of milk, such that we are contributing 23% of global milk production. Yet, funnily enough, our children are not getting sufficient amount of milk. And ghee, which holds such an important place in Ayurveda, is rarer still. So I'm going to end my talk with a challenge to all of you, which is to figure out how ghee, which is such an excellent nutritional source and also highly recommended in Ayurveda, into a format so that it can be easily put into the ready to prepare porridge or complementary foods given out through the states to malnourished children. Right now, it is recognized that young infants require a high energy nutrient source, and the cheapest that is available in the market is soybean oil. Although traditionally we would prefer to give ghee. Now, can you think of a way in which we can make this ghee in a format so that it can be put in a ready to use porridge? Because if we were to give this ghee as a separate packet to add into the porridge, it is very likely that it will go into the family food pot and the child is not going to get it. Mixing a fat into the food also is a problem. So can you think of a interesting way in which ghee can be formatted, perhaps as a powder, as a nanoparticle, and then put into the ready to eat mix, so that all a person has to do is add some hot water and a nutritious complementary food is ready for a child. Another way in which you can imagine is, are there any new formats for this ghee that we can think of? Can we eat it like a toffee? Can we give multivitamin fat soluble pills in a form that is solubilized with ghee? And therefore improve the uptake of ghee into our food system. I wish all you students the very best in trying to think of ideas on how Ayurveda can be combined for One Health.
Hello everyone, I'm Rajpreeti Sabharwal, sensory expert from Tag Taste Foods. Today, the video that I'm shooting is specific to the relation between Ayurveda and sensory. This video, I believe, is specifically for the consumption of IIT Jodhpur, and it is my duty today and my responsibility to leave you with certain ideas which you can explore. At Tact Taste Foods, sensory sciences we approach from two dimensions, the dimension of modern science and the dimension of Ayurveda. We try to include as far as possible. But right now, the knowledge of Ayurveda is very limited. So let us first start with word Ayurveda. Within that word, I will like to focus first on the word Veda. Vedas, we all know there are 4 Vedas, and what are they about? They are about the absolute knowledge. Knowledge with specificity of what? Well, Vedic sciences believes that the cosmic energy is there which regulates us. We are impacted by the planetary movements on not only Earth as on its whole, but even us individuals are impacted. It is essential that we harmonize our energies with the cosmic energy in order to be able to live a healthy and good life. So Ayurveda specifically is the sciences which dwells upon this aspect of food. Consumption of food, perception of food, digestion of food, assimilation of food, transportation of food, etc., etc. It's a holistic science. It's a way which completely looks at all the aspects of it, but very little of it is known to the world. Why? Because the perception of Ayurveda amongst all of us is that it is the sciences, medicinal sciences, in which dwells upon making a diseased body disease-free. But this is not so. I will like to recite a shloka from Ayurveda, which is Swasthasyam swasthya rakshanam aturasya vikar prashamnam. The second line is about this, making a diseased body disease-free. But the primary objective is in the first line, which is about keeping a healthy body healthy. And it is here that the complete understanding of food, its consumption, its perception, how the gut and the brain axis is functioning, and how it is getting broken down into chemicals, how it is transported, assimilated, and finally it converts into energy at the cellular level. Everything, I believe, is a part of Ayurveda. So there is much to be taken about, if you want to dig deeper into it. But specific to sensory sciences, there are 5 aspects which I will talk about, which can be of interest to some of you. So we start with the word taste, the definition of taste in the modern sciences and in Ayurveda. In modern sciences, 5 basic tastes are sweet, sour, salty, bitter, and umami. They are so called as basic tastes because they get captured on the tongue. This capturing is through receptors. And when were these receptors discovered? As recent as 31 years ago only. A generic receptor was discovered, and in 2010 they discovered for salt taste the exact pathways. So it's a very recent science even from the modern sciences point of view. But in Ayurveda it's ancient science. When they say taste, there are rasas is the Indian word for it, the Ayurvedic word for it, and there are 6 tastes, not 5. So what are these? Sweet, sour, salt, bitter, of course these 4 are there. Umami is not a part of it. And then other 2 are there. The other 2 are astringency and pungency. So let us look at modern taste now. These 2 words, new words, astringency and pungency, where do they feature in the modern sciences? In modern sciences, they are getting captured on, not on the tongue they say, but instead on certain nerves which form a network on the face. And these nerves are called the trigeminal nerves, which scientifically, medically, they capture pain. And hence in modern sciences, these 2 which are categorized as rasas in Ayurveda are categorized as irritants, chemesthesis. Chemicals cause irritation which is captured by the pain sensing nerves trigeminal, and hence the perception of enjoyment, of pleasure with respect to astringency and pungency is not a part of modern sciences. It is a part of Ayurveda. We cannot eat food which does not have spices. Spices have two dimensions. All of us think it's only the sensory dimension of smell from outside and inside mouth, but it is not so. More important is the dimension of touch inside mouth, the impact of the spices inside mouth. That gives us pleasure. So, it is not negative for us, it is negative for them. But suddenly we feel at Tact Taste, there is a rising interest even amongst the companies, multinationals. They are looking at astringency and pungency because the consumers have changed their perception towards spices. They are looking at it as a pleasurable mode. So before I go any further with astringency and pungency, I start with the first point of interest, which can be, some of you can dig deeper in. The word is umami. Umami, as per modern sciences, is a taste because its pathways are known and identified and categorized. But and in modern sciences, one word, deliciousness, is what describes it. Continuous secretion of saliva. You may put something with umami on a part of tongue, but all your mouth, the entire cavity, oral cavity, you feel the deliciousness. You swallowed it, and long after that, you continue to feel the pleasant aftertaste. So, when we look at Ayurveda, is there an equivalent to umami there? There is no equivalent to it because it says that yes, deliciousness is the important aspect, and all that everything that you consume needs to be delicious. So when we look at our traditional food, whatever region of India it is coming from, the spices are a part of it. We have started thinking at Tact Taste that maybe the way those spices come together, the chemical reactions which ensue between those spices and chemicals leads to creation of certain chemicals which give the same pointers as umami, continuous secretion of saliva, deliciousness everywhere, a long pleasant aftertaste. When in the case of umami, it is coming from glutamate, it is coming from iocyanate, it is coming from guanylate. So which are the chemicals which can be in Ayurvedic sciences, in our traditional food? Can we identify any chemicals which lead to deliciousness? This is the first point of thought I am leaving you with. The second point of thought I am coming to is what I've already introduced to you as astringency. Astringency is something which is going to give an impact inside your mouth. We are not talking it in terms of salty taste or no, it is not that. There are chemicals in it. All the foods have got chemicals, by the way. And the chemicals dissolve in saliva, and when they get captured on the tongue, it becomes basic taste. When they dissolve in saliva or not, I don't know, but they somehow impact the trigeminal nerves, and what do they become? They become trigeminal sensations, they become chemesthesis as per modern sciences. But when we look at Ayurveda, the understanding is so great and deep at the chemical level, because rasas, tastes are nothing else but evidence that certain category of chemicals are present in your food. And every major meal should have all these 6 tastes, otherwise one particular category of chemical, when it goes missing, your body is not replenished with respect to that, and what happens ultimately is that you, in spite of being full, being full on tummy, you start to crave for food again and go snacking. So here I am getting into mix matching, from sensory aspects into nutrition, into satiety, into satiation, into mindful eating and all that. Everything is interconnected in Ayurveda. That is the beauty of it. So astringency has tannins as the chemical. They are very important from sensory aspect because they break down saliva. When saliva goes missing in the mouth, water rushes in and what mouth watering starts happening because of astringency. Astringency, because of the tannins, the chemicals, is very important part of nutrition. All the superfoods, you can study them a little deeper. You will find that cranberry, for example, and all other superfoods, everything is either tannins or pseudotannins. So suddenly, as I said, from the point of view of sensory, the West is waking up to astringency and pungency, and even from the point of nutrition, they are waking up. Tannins are important, and how does a very poor man include all 6 tastes in our subcontinent in the food? Well, simple. Look at dal. Dal has got tannins, and when we put spices into it, a simple tadka can ensure that all 6 category of chemicals are present when it's a combination of dal and chawal. And by the way, protein wise also, all 9 essential proteins are present when you combine dal and roti or you combine dal and chawal. So Ayurveda is really, really deep and has answers to most of the things, and these are just the snippets I'm sharing with you. I have spoken about 2 aspects. I'm yet to speak about 3 more aspects which can be of interest to you. Coming to the next word, pungency. What is pungency? It's again action, again hit. Have you ever tried? Open a bottle of mustard oil and sniff it, and suddenly what happens is your nose cringes. Why? Because just the volatiles of the mustard oil have left an impact and hit your trigeminal nerves, which are stationed in your nose. So when you consume that mustard oil, similar impact is felt inside mouth. It can be raising of temperature, it can be irritation, it can be tingling, it can be so many pleasurable sensations. And yes, when a particular threshold is reached, when you're eating chili, it is pleasure till a certain threshold. Beyond that, it becomes pain. So this understanding of pungency, the world is waiting for this kind of understanding. If not us Indians, then who is going to give it to them? So any one of you could actually delve deeper into the types of chilies and what is the threshold for the Indian palate that till this point this chili is pleasurable, and beyond this it is not pleasurable but gets converted to pain. So I am now moving to the 4th aspect of it, which is the healthy and tasty paradox. In the way we perceive food to be, we think that if it is healthy, it will not be tasty. If it is tasty, it is going to be unhealthy. This understanding is what we are constantly fighting it out at Tact Taste. That if you move your focus away from the tastes, the basic tastes a little, and get into the wider aspect of sensory, which includes texture, which includes aromatics, that is the retronasal pleasure and all that. So many other aspects of food are there, and then you actually explore new dimensions of pleasure to the food, which are in addition to the dimension given by the sugar, salt and the fat. In fact, if it is cleverly done, you can reduce the salt, fat and sugar and yet end up increasing the sensory pleasure experience of the food inside mouth. It is possible, and some of you can think about that also. A lot of research is on in the Western world. The sugar has got the maximum share of finances, and then salt, etc., the bitter blockers are there. So many aspects are there, and we come to the last aspect, which is very intriguing for us at Tact Taste, and that is perception. It is the same food I'm consuming. One person perceives it to be tasty, the other person perceives it to be not tasty. Will the brain gets this information. One brain gets tasty, other gets not tasty. So what kind of instructions the brain is given after that? Do the instructions given by the brain with respect to digestion alter because the perception is different? This is, I have a feeling Ayurveda will definitely have something to say on it, but we have no clue what it is about. This text is mostly in Sanskrit, and that is a bigger hindrance for most of us. So I leave you with 5 aspects. I am repeating those aspects. One is umami in Ayurveda, deliciousness, in other words, in Ayurveda. Second is astringency, how we can give something to the modern world in aspects of astringency. Then the third is pungency. Similarly, the global world is very interested in it, and we feel we should be the ones giving inputs there. And the fourth is this paradox of healthy versus tasty, how to make food tasty and healthy, healthy and tasty is most important thing. And lastly, perception. I could say the sixth angle also is there, the gut and the brain axis, which needs to be explored. The world is just waking up to it, but Ayurveda has already, I'm pretty sure, a lot to offer in that area also. So thank you so much for giving me your ear, and I hope there is something you have gained out of it. Thank you.
Hello everyone, myself Dr. Mansi Mukherjee, an ecologist by profession. I've been working in IIT Jodhpur for the past 2 years. Today's topic of my talk is One Health Framework, the Ecological Perspective. So before I begin the talk, let me congratulate all of you on this Ayurveda Day. So let's begin with understanding what exactly the One Health Framework is. So basically, the One Health Framework is a multidisciplinary approach which recognizes the inextricable interconnectedness that exists between the human health, the environment health, and the animal health, so that the wellness or the well-being of this entire ecosystem is maintained and is sustained. And this again brings us to the most important points, that is, One Health Framework indicates that all 3 components are intricately related or linked, and there is a collaboration amongst various sectors in order to achieve this One Health. Sectors like the veterinary science, the ecology, the environmental science, the technological advancements, the medicine, and everything comes together to actually achieve the One Health. So moving further, how is Ayurveda and ecology coming together? How are they playing a role in achieving this One Health framework? So let's begin with this ecology, wherein if we see how Ayurveda comes in, so these are the major 6 perspectives that follow common in both Ayurveda as well as ecology. So as you see here, we begin with, the balance in nature. Ayurveda emphasizes the importance of maintaining ecological balance. It believes in a philosophy where the disease often results due to an imbalance in one's internal environment and the external environment. And it is the same in ecology, when an ecology actually believes in emphasizing the significance of preserving equilibrium in an ecosystem. So where all the components of the ecosystem are in equilibrium. Now let's come to the biodiversity and conservation. So in Ayurveda, it is said that the value of diverse plants and animals is very, very important to maintain the practice of medicine in Ayurveda. So it indirectly or directly participates in conserving the biodiversity of an ecosystem. Now let's come to the third point, where we talk about preventive health. So both Ayurveda and One Health promote preventive health practices. Ayurveda emphasizes diet and lifestyle as one of the important perspectives in maintaining wellness. And while the One Health perspective in ecosystem actually talks about outbreaks of diseases like the zoonotic spillovers or the pandemics that we have often seen, actually can be more tackled through preventive measures than curable measures. So this is how they both are in sync in the thought that it has to be preventive health than the curing health. Now, coming to the next perspective, which is interconnectedness that we are talking here. So, Ayurveda teaches us that we are connected to nature and that our well being depends upon the health of the environment. Similarly, One Health framework underlines that health of the humans, the animals, and the environment are deeply interconnected. So, both Ayurveda as well as ecology follows the same rule of interconnectedness. Now, moving further, we are talking about sustainable practices, and Ayurveda directly or indirectly follows the same principles of One Health framework in ecology, where the sustainable and responsible use of environmental resources through practices that are more sustainable in nature is enhanced. So, both advocate for the conservation of natural resources to ensure the well being of future generations. We are supposed to leave them our treasure trove of Ayurveda and ecology in the framework of One Health so that they have a sustained future, right? Now, let's come to the next point where we are talking about community and holism. So, Ayurveda places importance on the individual's role within a larger community and ecosystem. So, which means the holism is actually inclusiveness of each and every entity. That's what we talk in ecology. So, including all the technological institutes, the organizations of various sectors or stakeholders from the private and government partnerships, everything is equally important. All the inclusiveness is equally important because we have to work as community, and holism is a path to attaining the One Health framework that we often keep talking about. And last but not the least, once we have achieved this One Health framework through the Ayurvedic principles and ecological principles, we have to understand that there is a huge necessity of including the technological advancements both in the field of Ayurveda as well as in the attainment of One Health. So I always keep talking about techno-ecology, wherein the technology is utilized in the field of ecology, and vice versa, the ecological ideas are used in the field of technology for the advancements, and it holds true for both Ayurveda as well. So, as you can see, that integrating these modern ecological technologies into Ayurveda can actually enhance the efficacy and accessibility of Ayurvedic healthcare. So, when I talk about the Ayurvedic healthcare, I talk about both the production, the utility, and the way you actually make it sustainable throughout the generations to come. So we talk about the agroeconomy that is also a part of this technological advancements we are talking about. We know that we have a huge advancements in the fields of agriculture right now, like the permaculture or precision agriculture, which actually plays a major role in achieving our One Health framework. And Ayurveda actually follows all of it and should be continuing with it, wherein we know that organic farming that is actually practiced in Ayurveda, and that is how Ayurveda plays a major role in achieving the One Health framework. As you can see, I have mentioned some of the important pointers here: the organic farming, the agroecology, bioremediation. We also have bioprospectings that we could do through Ayurvedic knowledge, the traditional knowledge that exists, so that we can produce certain advancements even in the field of technology. Remote sensing and GIS plays a very major role in identifying the vegetation through spatiotemporal temporal changes, so that we can understand what could actually be grown and what not, and where it can be grown and where not, so that there is a sustained way of agriculture system, wherein we also talk about permaculture, which is the same, where we actually look at the area's natural ecosystem and use the agricultural perspectives in there. There are several other technological advancements that can actually be used, inculcated in the field of agriculture and ecology to attain the One Health framework. So, based on this, by integrating the Ayurvedic principles into One Health framework, we are unlocking new pathways for comprehensive health solutions that benefit not only the individuals but also the entire planet. And it fosters a harmonious coexistence of all life forms in our shared environment. So, with this, let me come up with the question that I leave open to all you participants, which is, in what ways do you think can Ayurveda significantly contribute to improving ecological well-being within the global One Health framework? Make sure that it is in global perspective. Thank you so much for your time. Thank you so much for listening. I hope you have a great time in participating in all the events, especially the one that has been organized as an ideathon. All the best. Thank you so much.